Hey guys, it's Jen, and I am back to give you an update on what's going on in my world of medicine. And unfortunately, this is a world that a lot of us are trapped in. So I think sharing this helps other people know what's going on, because we really need your help to join this fight and stop these things from happening. In April, we created videos and a petition asking United Healthcare to talk to me because my life-saving treatments weren't being paid for by them. I was putting the pill 100%. We did get their attention after 4,000 signatures and hundreds of thousands of views of the video. They immediately said they would pay for my infusion and they would help with my other costs. We trusted that they would do so because they gave us a prior authorization. The next month, I find out that that prior authorization doesn't cover all the things that I need, so I have to go back to them in May and get another prior authorization. Then in June, I wasn't doing so great. I was starting to decline, and declining is really scary. So I called my doctor's office and I told them what was going on, and they said, we got to get you in. You need an infusion now. You can't wait. So we call the insurance company and tell them, and she says, yeah, we got you. You're covered. I get 2 prior authorizations. I'm covered. Then I find out in June, right before the infusion, that the doctor's office can't get the insurance company to approve the necessary components to actually administer the infusion. They only approved a 1-hour infusion, which would kill me, actually. The infusion has to be done over a period of 4 hours. They couldn't get them to approve the medications that are necessary to protect my blood pressure or even the monitoring for my vital signs. It was shocking to have to hear that just a few weeks out from when I need this treatment. I didn't know what to do. So I end up contacting my senators, Senator Shaheen and Senator Hassan. And I tell them this story that's been going on since April, and I've jumped through every hoop and I've done everything they wanted, and yet I'm still not getting coverage. And they said, you know what, we will help you, we will help you. And Senator Hassan and Senator Shaheen both made inquiries for me. One of them assigned a caseworker for me. They contacted CMS, which is the Centers for Medicare Services, who also opened up an investigation for me. So I had 2 United States senators, 4,000 signatures on a petition, hundreds of thousands of views on a video. And finally, we get a new prior authorization. This one has everything. It's got the infusion time, it's got the medications. I'm told that the doctor is going to be covered in network, that all of these things are in this prior authorization, and we finally have my infusion covered. And this came, mind you, July 31st was the request. We didn't get that prior authorization in the mail until about a few days later, but the infusion was done July 11th. When Senator Hassan, Senator Shaheen contacted the company, and the company came back and talked to me again on July 31st, we filed the request for them to appeal to get the infusion covered. Well, they made it valid for July 31st, not July 11th, the day of the infusion. So guess what happened? I go home, I've talked to them. You think we're ready, right? This is September. I'm talking to you folks right now. September 2023, if you listen to this a little bit later. We started this in April. And as I sit here today, the claim was in part denied as not necessary. And they said it wasn't necessary to monitor my vital signs while I'm under sedation for 4 hours. They literally refused monitoring my vital signs. And they also refused to cover the doctor as in-network, which they had promised to do. And let me give you a big piece of that information. The doctor is the only medical doctor in the state of New Hampshire who does my infusion therapy. There is zero choice on who to go to. United Healthcare has not one doctor to offer me, not one service provider that is in-network. So supposedly under the law, they're supposed to cover the doctor as in-network. And you know what they did? Nope, out of network, which means they pay my doctor less, ripping him off, So how is he paying the staff that he needs to monitor me for 4 hours while I'm getting infused and under sedation? And when I come out of it, I can't function. I have to be assisted. And oftentimes I come out of it getting brutally sick. It's not fun to have these infusions at all, but they saved my life, right? That's what I'm fighting for, literally, my life. And I'm having to beg for it over and over and over again, month after month after month, despite 2 United States senators, despite over 4,000 signatures, despite a social media campaign that went across every platform. They know, they feel safe that nobody's going to take away their profit. You know, United Healthcare made $20.1 billion last year in profit. Some of that's money they collect in Medicare premiums that we pay. And then they deny those dollars to us when we need them. I don't know about you, but I worked my whole life. A lot of times I worked with more than one job, and I paid into the system knowing that if something happened to me, it would be there. I was an EMT, I served my community. I did everything right. And breast cancer caused me to get the most painful disease known to medicine, complex regional pain syndrome. And one of the worst cases is small fiber neuropathy. They tell me I shouldn't even be able to feel the ground to walk on. And I'm fighting to stay alive, but I need your help. We all do, because it's not about if this happens to you, it's when. We all get sick at some point in time. Nobody gets out of this world alive, but we all want to live with quality and with dignity. And we can't do that when private for-profit corporations like United Healthcare rip off us. They take our tax dollars, they take our premiums, they force us to pay co-pays and co-insurances, and they deny and they delay care until we are dead. That needs to stop. So tag United Healthcare in this video. Let them know you've heard me and you know that there are thousands and thousands of people out there just like me, suffering and fighting and begging private insurance companies for the right to stay alive. These companies get away with it as long as we allow it. I know for some of you, my story hits home because it's happened to you, it's happened to a loved one or someone you care about. If you want to help us fight, go to careofacost.org. We need you to join this fight. It's going to take all of us to be the voices that the Congress people hear, so they hear our voices loud and clear and know that we vote. And they're not going to get our vote unless they give us our health care.